Hello, how she
हाँ जी मैम।
pronounce her name? Akulata. Okay, so this particular module is about system management, basically to understand how a system works. Okay, system can be for actually here it is referred to the hospitals basically. Okay, and we will be talking about types of systems which are open and closed, and why should we adopt a system approach, what is a system approach, and then we'll be talking about which are the various tools which we can use for transcription, and then certain ethical and legal responsibilities, how they are important. Also, we will be going through preparation of various medical reports, and then which are the principle which can be used to complete documentation and medical records. Okay, so if we talk about like first chapter, it is management and system. So, so first of all, what is a system? Basically, it is you can say like it is a sum of multiple things. Basically, many pieces they come together, or you can say subsystems or many parts they come together. They make a system, and when you like take decision on particular part, it actually impact the whole of the system. So for example, here if we refer to a particular organization, so there are many like departments in particular organization, and then there are certain external stakeholders also. So any decision which is taken like internally or externally, it affects that particular system. So as they have given the definition, like it is defined as sum of total individuals, but interrelated parts, and here they are referring them as subsystems. When they are like put it together in a specific pattern or plan, then then they are able to achieve a certain desired goal. Now there are certain components of system which can be like, first of all, though a system has many subsystems. Okay, and to make a whole system, they should be put together in a systematic way. Then having I'm like being part of a whole system, there are certain boundaries which also exist. Then a system always has certain specific goals, okay, which all the subsystems come together, and basically their target is to achieve that particular objective. Then it is very important like there should be a harmony between all subsystems, because they are interdependent, and this interdependent relationship is very important, because you can refer to a jigsaw puzzle. So if like one part is affected, it is going to impact the whole of the system. Now coming to like the interrelationship of subsystems. So first of all, one of the important attribute is flow, which exists among all these subsets or subsystems, you can say. Why? So there are certain other like further subsets to this, like information, then financial part, then logistic part. So these things play a very important role, and these need to be focused. Then second thing is the structure, how these subsystems they are related to each other. They can be like interrelated by physical attributes, geographical or organizational. So they can be intertwined in a structure by following these particular things. Then next point in this is procedure. So there are certain procedure. Actually, here we are referring procedure to certain planned activities, and they basically affect each other. So, for example, a subsystem's performance, if it is like going good or bad, it is going to impact the whole of the system. For example, if we talk about an organization where there are multiple departments like finance, admin. So, for example, if there are certain lacunae or constraint in financial department, so of course it is going to impact whole of the organization. One very important thing about interrelationship is feedback and control process. Why it is very important? So that by the feedback, it actually provides a opportunity to improve any constraints or challenges which are formed. Now, if we talk about like what is system, so it can be anything. We can refer it to as simple as a human body in biological form, or if we talk about like physical system, it can be any machine, or if we talk about like social, what is a social system? So it can be any commercial organization, any NGOs. Here we are going to focus on social systems which are man-made, and they basically talk about relationships of multiple subsystems, as they are each and every subsystem is very critical to a particular social system. Now, why social system is important? Because it involves human beings. It always involves their attitude and perception, and these really impact on working of that particular social system. Now, coming to like what the system can be of two types. It can either be like closed or it can be open. So if we go through like what actually a closed system is, so basically closed system is a self-regulatory sufficient system, and it actually doesn't have much interaction with the environment in which it exists. So coming to this particular figure, as you can see, there are certain inputs, they go through multiple process, and there are certain outputs. The feedback system is within the system. There is not some third party feedback, and then certain corrective actions are taken to control this particular scenario. The feedback and control system is within part of the system, so no other external environment is part of this closed system. Now coming to the open system, as you can see from the figure, so in open system there is a hierarchy, there are various division and departments, they are interlinked to each other, and the environment, it consists of multiple subsystems like social, economic, political, and legal. And if we talk like why we are talking about open system, because actually it helps in the identification of critical subsystem in an organization, and because we have been talking about like how a simple subsystem can impact the whole system. So these if we like found any issues or any process related issue in particular subsystem, we can like identify, and then uh, we can like tackle that, and somehow it helps to improve the relationship with other environments. As you can see in figure number 3, you can see like there is a system, there are certain external or departments, external stakeholders are there, and then internally also there are multiple departments. The whole system, it shares certain things like the objective, and then the resources, and what are the strategies. So basically there are multiple subsystem, but as a whole the objective of the system, they all the subsystem, they adhere to that. Now coming to in an open system, um, equilibrium has to be maintained in any system, whether it is closed or it is like open system. When we talk about open system, you can say it is more fragile. Why? Because in this, the level of equilibrium is never static, as um, like open system is dynamic. Why it is dynamic? Because there are always changes are seen in all subsystems, because there is a you can say in an open system, all the subsets, they have a liberty to adopt certain things. They are not like, you can say in Hindi, Lala ki dukaan. So they have certain regulations. There are certain things. There are opportunities for like improvement. So this is because that is why there are at subsystems there are changes, and in open system, that is why the environment it is like changed, always changed. So sometimes the equilibrium has to be maintained whether it is a open system or closed system, but somehow it is little difficult in case of open system. Okay, now why we are like giving so much emphasis to this? Because, for example, as a manager who is working in a system, it is important to find out what are the critical things in particular subsystem, and then to understand the interrelationship with each other, because somehow it impacts the whole environment. Equilibrium state which has to be maintained, it can be only maintained once there is a harmony between all the departments, you can say. And uh, it is a manager, for example, a project manager who's taking care of a project, but in that project also there are certain things. For example, if we are like in health, if we are implementing any health program, so there are certain teams which are working. There might be some finance team, there might be some administration team, then there will be programmatic team, then there will be technical people. So contribution from each and everyone is very important. And but it's the important thing is that all people should be on the same page. They should adhere to the objective of that particular project. They should understand like what are the outputs of that project, what is expected from their team, and they should work together. Okay. Now, as a manager, certain things are very important to understand the what are the roles of all teams and how a equilibrium can be maintained. How this can be done? So information plays a very, very important role in this. Why? Because, for example, a manager, he is well versed with certain legalities and certain legislations or certain regulatory measures. Then somehow it helps him to take care of to first of all to so understand the critical issues and how they can be addressed. A simple example given here is like, for example, a manager is there. Now you can say, for example, somebody is taking care of the HR team. So if he is well versed with the HR policies or regulations in that organization, or you can say a system, open system, so he understands what are the rights of employees, how the grievance addressal department can work, and then if there is certain crisis or there are certain challenges, how they can be taken care with help of other subsets. So that is why it's very important that a manager should be employed who is very well versed with all the regulatory issues, and he has a informed choice about that. Now, we'll be talking about system approach. So, what is system approach? Basically, a systems approach talks about uh, it is based on a generalization that organization is a system and its components are interrelated and interdependent. So earlier, what was happening before 1960, a horizontal approach was followed in which many departments, they used to work in silos. They were not informed about, or they were not well versed with what the other department is doing. But now the system, it is looked at like all the departments, they have to work together. There will be a dependency on each other, but moreover a vertical as well as a horizontal system needs to be followed. And in which each and every, even in the like smallest department, it contributes in a significant way. So when we treat a system or an organization or a simple department, or you can say any program as whole, okay, then it is based on a systems approach. It's nothing, it's just like you are considering the whole entity as single, as same, okay, as one entity. This is system approach basically. So for example, the world, the example given here is like, if we consider the world, so it can be considered as a system, but it is a, like you can say, it is a collaboration of multinationals. Okay, so here many countries, they act as subsystems. Like for example, if we take a example of national country, one country. For example, if we take about simple example, if we take about India, so India is a system, and then all the provinces or all the states, they can act as subsystem. Every state has their own contributions, but they should be well versed with each other's work, and also they follow the same objective. Okay, so this is a system approach. Now coming to like, what are the characteristics of a organization? When we talk about organization, and here organization means a health program or hospital based setting. Okay, so what characteristics we can expect? First of all, though, it should be goal oriented. Let's take an example of a simple hospital. Okay, so a hospital is there, but it should have certain objectives, certain goals, like how they can be a good service provider, how they can help to tackle the morbidity and mortality. Okay, then system consists of several subsystems. This we already talked about. They are interdependent and also interrelated. Now, why we are giving so much emphasis on system? Because it helps in processing or transformation of inputs into outputs. Okay, we'll discuss more about inputs and outputs. When we talk about an organization is an open and dynamic system, what it says that it has continuous interface with external environments. So when it gets inputs from environment, and it also supplies its output to the environment. As we talked about, like open system, it is very sensitive. And why it is sensitive? Because external stakeholders also play a major role. External stakeholders can be government policies, competition, certain technological markets, and even the community. But we should keep one thing in mind, that although a system is made up of many subsystems, but each system has its own boundaries, which actually separates it from other systems. Now coming to like concept of system approach, how can it be utilized for management? So uh, in management, basically the main emphasis is given that system approach uh, is utilized. Why? Because each part of the overall system is dependent on other, and it cannot perform optimally without them. For example, if there is a hospital, you cannot say like, okay, if the admin part is little weak, so the whole system is going to shatter. For example, even simply like the infrastructure admin part, they are not optimally contributing in functionality of the hospital. Even then, it is going to be shattered. So each contribution from each subsystem, it is very critical, so that as a whole the same output can be achieved. For example, if one of the department or subsystem is not working properly, then it may actually affect the rest of the system, and this is going to impact the whole whole system to many extents. So uh, we can say, like if we talk about like system approach, so it can act as a framework in an organization, and we can consider any organization as natural ecosystem where actually each element is interdependent. Okay, so here we are using system approach mm, as a framework. Okay, now coming to like about this system approach. So basically, it focuses that system is not simply a collection of individual parts, but rather organized as whole. So I just talked about it. Like when we talk about system, there are multiple parts to that, but they are arranged in a systematic manner. They play their own roles in systematic manner. It's not just you can say it's not some herd, or it's just not a collection of certain subsets. No, they are designed in a very systematic way, and they play certain crucial roles. Okay, yeah. And then like as we have discussed, like each system plays a very critical part. So recognition of each and every system is very important, because when you recognize part of each subsystem, then only you are going to understand what critical role that particular like part in the puzzle is actually playing. And then, unlike closed system, open systems are fragile. Why? Because there are some external players there, and the system, they rely on these external key players for what? For basically certain energy, sometime logistic supplies, or certain informations. So it makes them more fragile. So as you can see, there are certain features of system approach to management. Okay, what are these? First of all, monitoring and taking action. Why it is important? So whether it is a system or a program or a project, anywhere, monitoring is very, very important, so that uh, first of all, though, it helps in adherence to the objective. Then if there are certain challenges or certain problems, that basically it helps in identification of those problems. And then timely actions to resolve these critical issues are very important, and it can only be done by monitoring. Okay, regular checking, like for example, even we have certain, you can say, electrical wire in our house. So if we are like doing regular checking, we know like where is the issue, and it can be like timely resolved. Whereas if it is neglected, so timely solution won't be there. Okay, next is interconnected subsystem. So as I already talked about it, like an organization is like a big puzzle made of many smaller pieces. And here smaller pieces, we can say they are the departments, or here they are referred as subsystems. They interact and depend on each other for organization to function properly. Now, one of the important thing is no isolations or no working in silos. Okay, you cannot understand a subsystem if you only look it into as an individual entity. We always refer like system works as a whole. So when we see them as whole, we know like how they are related to each other, and what critical part they are like playing. Like we know, like when we talk about any puzzle, each, even a very small puzzle part plays a very important to complete the whole scenario. So next is boundaries. So any organization that sets its apart from other system, it has boundaries. Okay, because it had certain parts which can be inside, like it has employees, or certain outside parts or external parts like the customer. So these boundaries actually, they helps to define the organization scope and limits. Now coming to the environment, open system, they are very sensitive. Why they are very sensitive? because there are external key players, and they influence the environment, this ecosystem. And if it is sensitive, there are certain changes, so a sensitivity level has to be maintained. So if something critical or something unexpected happens, so the organization can respond immediately. And because certain external factors, key players are there, so consensus from these key players is also important to modify or revise certain regulatory things. Okay. Now, changing environment. Open systems, they are dynamic. Okay. And this makes them because the system is changing every time, it is changing. So they can be influenced by multiple external factors. Here they have given example, like if there is a hospital, for example, and there are certain issues, like for example the human resource, they go on strikes, or sometimes like customer preferences are there. Customer preferences in the sense, like there are new technological advances and there is a hospital, it doesn't like upgraded itself for those technological advances. Of course the customers, they can divert to certain other part. Okay. So one system has to keep it updated to to take care of the advancements or these influences. And like management needs to keep an eye or a watch to like whatever is happening externally as well as internally, so that timely steps can be taken for that. Now, interdependence. This is very important because, as I told you, like it, any system is collective system of many subsystems. For example, in an organization, there might be multiple departments like business, production, sales, and other. Everyone plays a key role. Okay, and they keep on functionally interacting with each other and also showing interdependence on each other. So when we consider them as a whole entity, so they all share the same goals, authority flows are there, and resources are utilized by all the subsets. Now, coming to very important part is this whole organization. So basically, system approach, it helps to provide a unified focus or to a organizational effort. Why? So it helps a manager to look in a way that organization is a whole, and it's actually much more than all the subsets parts. I have highlighted this point, synergy. Why? Because as you can see, the output of a system is always more than the combined output of its part. So together, when all the parts in a machinery, basically, if you say in a car, like there are many parts, when they work together, of course, then only the car is going to move. So if we talk about a hospital-based setting here, there are multiple departments, but how they are going to help when there is a synergy between all of them. All the parts, they become more productive when they interact each other rather than sitting in silos or following a isolation or that kind of part. Okay, then any system, it can be multidisciplinary also. Here they have given certain other examples, but I would like to take example of a hospital. So in a hospital, there are multidisciplinary hospitals are there. There are different type of OPDs, different type of health domains. Then there are IPDs. There are so many departments, like admin department is there, then clinical department is there, then laboratory department is there. So we know, like in a as a system in a hospital based settings, there are multiple departments. Each and every department plays a very important role. So together, when they come together, they have a synergy. Then only a hospital-based setting can functional in a more productive way. Okay. Now coming to for example, there is when we are talking about this system approach as an overall theory. So if there is a like some pressure is there to change in one particular system, it is going to influence the whole entity. Okay, so there must be uh, adoption of system approach should be there, but it also represent that a balanced thinking on organization and management has to be taken care of. Okay, it's not like multiple departments are there and all the like departments team they have certain other vision, then it's not going to work. They must have a integrated thinking, because it helps to recognize the interaction and interdependence among different variables, and it helps to create a equilibrium environment. Also, it helps to understand the complex behavior of organization. It also like timely focus on any stressing interrelationship, and by using a system approach they can be identified and timely solution can be taken care of that. Now coming to management as a system. So what is management as a system? So managing a hospital, basically it involves synergy or coordination among numerous interconnected elements. Okay. Why? Because we want a high quality healthcare services which can be provided to customers, on in this case actually patients or community. Okay, so if we look at hospital management through lens of like system, we can understand like there are multiple departments. So if we talk like if we think about a hospital management system, there are many components. First of all, inputs. What can be the inputs in a hospital management system? There are many resources. When we talk about a resource, in any case, whether it is hospital based, it is health program or anywhere, it is almost same. Resources includes human resource. First of all, the people who work there in a hospital, of course it is doctors, nurses, or administrative staff. Then there are financial resources, budgeting, money, funding, everything. Okay. Then infrastructure. In infrastructure, we have, of course, the building and also the machinery system that comes in the physical or logistic part, basically. And then there are informational resources like the HMIS, Health Management Information System, where we deal with the medical guidelines, regulatory systems, or patients' records. Coming to the regulatory requirements, so these are very important. Why? So that there is a compliance with healthcare regulation. There are certain accreditations which have to be sought out. Then there are certain licensing requirements. They also serves an input when we are running a hospital management system. Okay, because based on these SOPs are there, standing operating procedures. Based on these, certain decisions are taken. Okay, and a uh, systematic functionality can be we can adhere to those functions basically. Now, when these inputs are in place, then comes the processes. There can be two type of processes in a hospital management system. One is clinical processes and second one is administrative processes. What all clinical processes have? They are basically certain patient care or service delivery basically come in clinical processes, which includes diagnosis, treatment, surgery, medical administration, and also patient monitoring. And these processes, they are basically supervised by medical protocols and best practices and evidence-based guidelines. Now coming to administrative processes, we all understand what administrative process means. So it means like a proper process where patients is registered, billed, the insurance processing is done, inventory management is done, and over that, facility maintenance is also done. Somehow, administrative processes, they play a key role because they helps in smooth functioning of the hospital system. Now, how these processes can help to achieve outputs. So, as there can be two type of outputs. First is patient output, and second is financial performances. When we talk about patient outcomes, so it actually means like what is improvement in service delivery, which can be in form of health improvements or recovery rates. And also, in previous diagram, we saw feedback. So feedback from the consumer or from the patients for their satisfactory levels. So it indicates when, for example, any when we provide service to patients and they are like satisfied with the services, so it can act as an indicator about the effectiveness of clinical care and service delivery provided to the patient. Now, coming to the financial performances. Financial performance, first of all, they help in revenue generation. Also, of course, any hospital, until unless it is a charitable hospital, but every commercial activity, they need to they need a running cost. Okay, so profitability somehow come into the picture. And when we talk about financial performance, it is important so that somehow it is also it is also helping in revenue generation and bringing helping in the running cost of the hospital system. Okay, cost effectiveness also. So there is a optimal utilization of all the funds, or when we talk about inputs, so inputs we talk about like funding, so it is used in an optimal level. And then also financial sustainability, this is very important part, because especially it is very important in closed system, because closed system there are not many external stakeholders are included. It is a kind of self-sustained system. So in that case, financial sustainability plays a very important role. Okay, now effective management practices, they contribute to achieve financial objective while they are using the resources in a optimal way. Okay, now coming to the feedback mechanism. Two mechanism can be adopted. One is patient feedback and second is quality metrics. If we talk about like patient feedback, the feedback can be from patient themselves or their caretakers, their families, their caregivers. Why? Because actually it helps to understand the quality of care they received at the setting, their satisfaction levels, and most importantly, what are the areas for improvement? Because a honest feedback actually provides a opportunity for valuable insights, why, like what is actually going wrong, or what needs to be checked, or what needs to be improved. So so these helps to identify critical challenges, and as soon as we identify the critical challenges, they can be addressed promptly. So patient feedback is very important in a hospital management system. Okay, next is quality metrics. What it all includes, basically all the clinical quality indicators. There are certain outcome measures. They help to evaluate the effectiveness of hospital management practices. Okay, and these are continuous processes. These are basically audits, like internal audits and external audits. So they help in quality check. Now, coming to interactions and relationship, there are three important points under this. These are interconnectedness, dynamic nature, and open system perspective. If we talk about like interconnectedness, basically it helps in improvement in clinical processes, because this helps to lead for better patient outcome and actually increase patient satisfaction. Whereas when we focus on dynamic nature, so as we all know, like there has been a shift. Like earlier, there were communicable diseases, but now we know that most of the diseases are chronic diseases and they are lifestyle diseases. Okay, so by this we can understand that the healthcare system, it keeps on uh, the focus keeps on changing. Okay, and then recently we have observed emerging healthcare trends, like for example the COVID pandemic. So every system has to prepare themselves to handle these emerging healthcare trends. Then there are technological advances also. Then there are demographic changes in demographic also. Now the you can say longevity has increased. People are living for like elderly population is increasing. So the policies, they need to be uh, like uh, they need to be changed according to the demographics. For example, as I told you, like now in every country there are elderly population. So policies need to make around them. Okay, and then for example there are health regulation changes. For like in COVID we have seen there was telemedicine. So there are so many advancement. The whole ecosystem is dynamic, because there are so many like things they are happening on daily basis. And check is very important on all these advancement. Why? Because for effective management, we need to keep a check on these things. Okay, these are very important, because when we talk about a hospital, there are inputs and there are outputs, and outputs are based on consumers, and here consumers are our patients. So they expect multiple things. Okay, and uh, uh, like I told you about technological advancement. So with these emerging diseases, technological advances, you can see like how fragile any ecosystem is there. Like for example, even a hospital, it needs to like take care of all the things. They have to be included in their like you can say their system. Okay, now, if we talk about like most of the hospitals, they have a open system. Why? Because they are not only considering they have their regulatory system, but they follow certain universal standards. Okay, so and also feedback is very feedback is included. When we talk about feedback, or certain other stakeholders are there, like sometimes donors are there, or like you can say payers or regulatory bodies, so they keep a check on them. Okay, so a very few important things are there when a system is open. First of all, it is communication. Okay, all the major key players, they should be informed about whatever advancements are there. Second is collaboration, because it helps in optimal functioning of any system. Then stakeholder engagement, most neglected part but very important part also, because multiple players, to bring them on same platform is very it's very difficult, but somehow it also helps in productivity of or working or to achieve same objective. Okay, it is they really contribute in a very very you can say they make the whole ecosystem better. Okay. Now, where we can apply this hospital management system theory. So, first of all, in strategic management. What is strategic management? As the name suggests, you are doing some management in a system, but in a strategic way. What is a strategy? First of all, in a strategic planning, we analyze the situation. What is the situation? Then there are certain goals are there. Okay. Then we take care of input, processes, outputs. Okay, this is any strategic management. So here, for example, we take a example of a hospital. Okay, hospital in, you can say, a very small hospital like 100 bedded or 50 bedded hospital. We want to run it. How strategic management can be done? So we need to understand the demography of that area. If most of the population, you can say the footfall is more of women and child. So they need to, this is like a situational analysis, like this particular hospital, it is catering to needs of which kind of community. Okay, demographics, whether it is women, children, or elderly population. Then defining the setting the goals or defining the setting the goals means, for example, the hospital decided to cater the needs of women and children. Okay, then also defining the priorities. In that we know, okay, you cannot take care of like every disease there. So for example, in this particular hospital we focus on pediatric department, and in like in women only we are taking care of institutional delivery. So for example, we are just focusing like in children pediatric department, we are focusing on you can say vaccination, immunization, or in case of women we are focusing on how to increase institutional deliveries. Okay, so these are like, you can say, this is how we defined our priorities. Now based on these priorities, we need certain inputs, means resources. We, and when we talk about resources, first of all, the first of all we have HR as a resource. So in this case we need to have um, like like if we talk about immunization, we should have trained healthcare personnels who can administer the vaccine doses to children. In case of women, we know that ops department should be there, and healthcare staff, female staff should be there who can help in institutional delivery. So this is, I'm just giving an example. Like if we talk about only one input like health or HR. Okay, so it actually take care of any kind of input we are considering. It should be in alignment with our goal, because in this case our goal is to increase immunization and also increase institutional delivery. Then then comes this, like in this strategy. Now next is allocating resources. Now we can see like how we can channelize the funds for these two particular priority areas. Okay, and then uh, as we are not working in silos, we are working as a whole system where there are many subsystems. Then like synergy between all departments should be there. Okay, and interconnectedness can be reached by among various departments. Like in this particular case, it will be clinical, administrative, and financial. Okay, every department should be in alignment with the main objective. Okay, as I mentioned you in the example. Now second is like quality improvement. So hospital management system theories is basically helps us to guide in quality improvement initiatives. Okay, and it actually aims for enhancing patient safety, also clinical effectiveness, and most important is service excellence. Okay, any hospital system, basically the main objective is service delivery. It should be at the excellent level. Okay, so by using a system theory, or you can say by working in a strategic manner, we can actually facilitate quality improvement. Now, performance management. When we have in all the hospitals, human resource, it is one of the important pillar of, or you can say one of the important contributor in the inputs. Okay, but you need to check on the quality. So how you can do? By monitoring. And how HR can be monitored? By KPIs. In corporate world, we have KPIs, but now any human resource, it is like in any setting, but now there are designated KPIs so that the person knows what is expected from them, and they can follow those performance indicators for their to give their best. Okay, KPIs can be like in hospital based setting, it can be like what is the wait period for patients. Okay, what are the infection rates, and targets, for example, how much, like we I have given you example of immunization, so we can set some standards. Okay, this many percentage of total OPD we are going to reach the like immunization. So certain indicators, performance indicators have to be established uh, to basically keep a check on performance. Okay, so when we talk about management as a system, it actually basically helps to provide a comprehensive framework for what? To understand and optimize operation hospital. And adopting a system, it, it actually fosters multiple things like collaboration, innovation, resilience in the dynamics, and complex healthcare environment. Somehow, why all these things are important? Because we only have one objective: how we can improve the outcomes for patients and community. That is the ultimate target, or you can say objective, of any hospital system. Okay, now coming again to different type of organizational system, we have two: open system and closed system. Okay, I have already talked about in open system, we have say from the external stakeholders also. External stakeholders can be the funders, can be regulatory bodies, or they can be the patient themselves. They can provide the feedback. Okay, and their feedback actually helps for improvisation. On the contrary, when we come to the closed system, they are not that much open. They believe in their own system. They take care of their own sustainability. Okay. There are certain things which need, when we are talking about open system, there are certain things which have to be kept in mind. First of all, stakeholder engagement, environmental factors. This we have already discussed. One important thing is resource exchange. Okay, this is very important point. In this, hospitals, when they have inputs from external resources, which can be like grants, funding, or even human resource, at that time they have to take care of these inputs. Okay, and these help in output dissemination also, like by utilizing these inputs. Like for example, if we have like the HR in full strength, it will help in patient care services. Okay, I think we can stop now, and then we can discuss rest in next class. Okay.
ओके मैम।
ओके, अभिषेक कल किस टाइम करनी है क्लास?
जैसे आपको लगे, सही लगे।
सीमा वाज टेलिंग मी ना आफ्टरनून में कर लेते हैं।
कल छुट्टी है क्या?
आई डोंट नो, मतलब मेरी या आपकी?
कल क्या है? ट्यूसडे है, हाँ चलेगा। आफ्टरनून। आफ्टरनून एक बार हम डिस्कस कर लेते हैं, अगर नहीं तो सेम टाइम कर लेते हैं ना, 8 to 9, इफ यू आर कंफर्टेबल।
एक्चुअली इट इज माई 11:30
ओह अच्छा अच्छा। ओके ओके ओके
हाँ,
ओके।
आई गॉट एक्चुअली कंफ्यूज, शी आस्क्ड मी 8 to 9, आई सेड ओके, मतलब 7 to 8 भी
अच्छा
ओके, क्योंकि ये 10:30 हो
अच्छा
जाता
अच्छा।
है।
अच्छा अच्छा।
अदरवाइज इट्स ओके, आई स्लीप लेट, नो इशू। ठीक है, चलो,
नो
ओके,
प्रॉब्लम।
गुड नाइट, गुड
ओके
नाइट
ओके।
एवरीवन, गुड नाइट,
गुड नाइट।
बाय।